Hi, this is Kat, and I'm going to be presenting on the deadlift. So to start, I will go over the movement description. So the deadlift consists of three main positions or movements. So there's the starting position, the pull through, and then the finish position. The starting position is this right here. So the knees and the hips are both flexed. The feet are about hip width apart, and the bar is right over the feet, about an inch out from the shins. The hips are hinged or flexed, and the knees are bent, and the back is extended. And the back is kept flat, and all the force is coming from driving through the heels, and you're lifting up through your toes, driving through your heels, sorry, activating your glutes, and that is what initiates the pull through. So the pull through is where the hip and the knee concentrically extend. So that's going from here to here is the pull through. So all the force is coming from the hips to extend the knees and the hips in a concentric motion. The hips extend and bring the pelvis forward and up. The core is engaged the whole time, and the back is kept flat, and the muscles surrounding the muscles of the back and the core are engaged to protect the back and keep it extended. Specifically, the lower back, a lot of people sort of tend to slouch here a little bit and pull from their lower back rather than engaging their glutes and really using the muscles. And I've seen it in my teammates in the weight room sometimes. They don't engage their back, and then they end up with low back injuries and low back pain, which can be avoided if you work to keep that low back engaged and the core engaged to really protect it. And then we have the finish position, where the hip, the knee, the abdomen, the back, they're all extended. You're standing up straight, the scaps are retracted, the shoulders are relaxed, the core is engaged, and that's the finished position. Now I will go over the hip design, and the hip is the joint that I've chosen to focus on. So the hip is a ball and socket joint. The socket is created by the acetabulum of the pelvis, and the ball is the femoral head. And unlike the shoulder, the skeletal structure actually provides much of the socket. The joint is classified as an anarthrodial joint, so it's a freely moving joint in which a sphere of the head or the head of the femur fits into the rounded cavity or acetabulum of the pelvis. Articular cartilage lines both the acetabulum and the femoral head, and the acetabulum also contains a labrum, which lines it, that provides more stability and shock absorption, and there's also ligaments that are on the anterior and posterior side that prevent unwanted movements, such as hyperextension and limiting internal rotation. And here is an image of that. So here's the femoral head, the acetabulum. Both of these are lined with articular cartilage. The acetabular labrum. Here is a ligament, and obviously there would be more. And then here's the femur and the pelvis. Now I'll go over the range of motion of the hip. The hip has a really large range of motion. It can flex and extend AB and AD duct, internally and externally rotate, horizontally AB and AD duct, diagonally AB and AD duct, and the pelvis can also interiorly and posteriorly rotate, as well as laterally rotate. And here are all of these motions. So here is flexion extension. Also note horizontal AB and AD duction is where the hip is flexed like it is here at 90 degrees, and then it horizontally AB or AD ducts. Here is AB AD duction, rotation, diagonally AB AD duction, and then here's pelvic rotation, and then lateral pelvic rotation. So the muscles that cross the hip. The primary flexors include the iliacus, the psoas major and minor, the rectus femoris, the sartorius, and the pectineus. The primary extensors are the gluteus maximus, the biceps femoris, the semitendinosus, and the semimembranosus. The primary adductors are the adductor brevis, adductor magnus, adductor longus, and the gracilis. And the primary abductors include the gluteus medius, gluteus minimus, tensor fascia latae, and then the external rotators are the piriformis, the superior and inferior gemellus, the obturator internus and externus, and the quadratus femoris. So now we'll go over the muscles that are active during the deadlift. So the primary hip extensors include the gluteus maximus and the hamstrings. And here is an EMG. Here are the hamstrings right here. This includes sumo and conventional deadlifts, but here we see a conventional deadlift, so we'll look at those bars on this graph. So here are the hamstring muscles, these 4. And then over here we see the gluteus maximus right here. So these are all the gluteus maximus, the hamstrings, they're all active to extend the hip. And the gluteus maximus is the primary hip extensor, while the hamstrings are mostly for stabilization. However, as the knees further extend more and more, the hamstrings start to contribute to that hip extension more. The gluteus maximus runs out of leverage at a certain point, and in hip extension, so the hamstrings become the primary extensor towards the end of the hip extension. We also see here that the erector spinae muscle is active, as well as other spine muscles, erector spinal muscles, to keep the back from rounding and slouching like I talked about earlier, and to really protect that back and keep it in the optimal position. Other muscles that are active include the shoulder and arm muscles that are acting isometrically to keep that bar in place. So these muscles act to keep the bar where it should be as you move from the starting position all the way to the finish position. Other muscles that are active, which is an interesting one, are the quads, or the rectus femoris. We see that active here, but it is less active than the rest of these. So the rectus femoris is a muscle that crosses the hip and the knee, and its action at the hip is actually flexion, while its action at the knee is extension. And obviously in a deadlift, the goal is to get from the starting position to the finish position by extending the hip and the knee. So the rectus femoris is needed to extend the knee, but then it also begs the question of, well, is it not also trying to flex the hip at the same time? But it's actually shown that the force that the rectus femoris produces to flex the hip is a lot less than the force to extend the hip that's coming from the gluteus maximus and the hamstring. So while the rectus femoris, or the quad, is active to extend the knee, it's not causing any contradictory force at the hip trying to flex it while we actually want it to be extended. And with that, my presentation on the deadlift is concluded. So thank you for listening.